Welcome to Rick's Tip of the Week. This is a subject that a lot of people don't like to discuss because it's embarrassing, but it's a fact of life. And they say that 1 out of every 3 people suffer from hemorrhoids. Now, you've seen these commercials on TV, and if you're in a group of 3, you know that one of you got it. Maybe you. Well, the reason I even bring this up is because I've had people ask me about them in the gym because of training. Heavy squats, diet, you name it, can create a lot of pressure at the end of the colon because you're pushing down, of course. And what hemorrhoids are, what people don't really realize, they are varicose veins. They're veins that get big and they swell up and they start to hurt. They burn, they itch, they bleed. They can be very, very annoying. I know a lot of guys who have them, and a lot of guys who don't take care of them because they're afraid to go have them looked at. They're afraid of the doctor going up there and checking it out, and it's really not that bad. I had them for years when I was wrestling, for years, and it would drive me nuts before a match, and they would bleed, and they would burn, and they would itch, and they'd bleed in the toilet, and I thought, God, I got to do something about this. Finally, I went to a doctor, and I said, what can we do? And he says, I said, do you have to cut them? Because I know that cutting them and stitching is a whole month or 2 of recovery, and it burns, and it's just miserable. He said, no, there's many ways to take care of this, and for you guys that are afraid to do this, there's a pretty simple way. What they do is they numb the area. They go in with a little gun, like a staple gun, which you don't even feel, and it shoots a rubber band, a tiny little band like you'd find on braces, around the base of the vein, which strangles it. And then they use, they freeze it with a spray, and then they just disintegrate and go away. Simple as that. You don't even feel it. You come home, you soak in a tub for a couple of days, for maybe a half hour at a time, and they vanish, they disappear, and you'll never see them again. Maybe later in life you might get 1 or 2 back again, you do the same treatment. I made some notes about this because there are a lot of symptoms. Like I said, there's a lot of itching, there's pain, sharp pain, and then there's bleeding, and then you might not have any of that, you might just have 1 of the 3. You can also get what they call as a fissure, which is a little tear which comes in there, and it's about the size of a pinhead, but it feels like it's a razor blade. And you can get this from squatting. And when you're squatting deep, you're putting a lot of pressure on the butt and a lot of that on the opening, and when you squeeze and strain and come up, it creates even more, and it makes these little veins that come out. They are varicose veins. They're filled with blood, and as you squeeze, the blood fills up into them and they start to protrude. You can feel them when you go to the toilet, and then you can push them back in with a little Vaseline if you want and keep them up there, and they'll stay in for a while until you strain again. What happens when you stand up is the blood comes out of them and they pull back up. So I just want to bring this up. I know it's a touchy subject. I know it's not touchy for sure. I know it's something that's embarrassing for a lot of guys. They want to talk about it, and so I'm talking about it because I think it's something you need to know. They have over-the-counter things like Preparation H. They have all types of ointments that shrink and reduce and relieve the pain. Calamine lotion comes in an ointment. It stops the burning. It's a cooling sensation. I have all these from my doctor. You can also get a prescription from him that does things. And one time he gave me nitroglycerin ointment. He said what that does is it creates blood to the area, if you have a fissure, of course, and it helps it heal because there may not be any circulation. My question to him was, nitroglycerin, if I sit real hard, am I going to explode? And he just laughed, no, you're not going to do that. So I wouldn't be afraid to go to the doctor if I were you and have them looked at. It's really painless, to be honest with you. They do open it up and go in with the scope. It's a little uncomfortable, but it's not terrible. Now, the other thing they can do, which I've had done, is they inject them, and it's a phenol oil solution, which basically creates scar tissue at the base of the vein, and when the scar tissue adheres and starts to grow, it stops the blood supply. By stopping the blood supply, they disappear. Now, I've had some bad times where they've really bothered me, and I've gone in, went into the doctor, he injected them. By the time I left the office and got in my car, it had already shrunk down. It was like night and day. What a relief that was. So if you guys do suffer from this, there's precautions you can take. First of all, add fiber to your diet. I have fiber every night. When you're on a high protein, low carb, you're not getting enough bulk, it will constipate you. Squeezing can cause these varicose veins. So having fiber helps relieve that. Maybe get rid of the symptom. Maybe you won't even get them. You might get 1 or 2. I've had as many as 9 that were removed. So take care of it. You don't want this to turn into something like colon cancer down the road, which who knows, it could not, but better to take care of it now. But the injections are painless. You'd think a needle going in there would hurt, and it doesn't at all. You don't feel anything. There's no nerve tissue there. And that's what he explained to me. So I go in, I ask for the injections. Maybe once every 6 months I feel an area that bothers me. I go and give me a shot, doc. And he does, gone from there. Anyway, I wanted to bring this up. I think it's something you should take care of. I think if it does bother you, call a specialist, which is a proctologist. They know this area well. They take a look at it. They'll analyze it. And you know what? It'll take a big load off your mind, because when you're having issues like this and you go to train or you go to eat or go out in the evening and you want to go to dinner and you know this is bothering you, it can ruin your whole night. It can ruin your whole week. It can ruin your whole month. It can ruin your whole life if you don't take care of it. So my advice to you on Rick's Tip of the Week, if you do suffer from hemorrhoids, if you do have this problem, don't be ashamed to go to the doctor and ask. Get it taken care of, and you'll be happier if you do. And that's my tip of the week, and stay tuned for more. I've got some guests coming out next week on Rick's Corner, and we've just reached over 12 million viewers thanks to you guys. I also want to tell you I have 2 books out. As you know, I have Bodybuilding for Dumbbells, based on the workout in the 70s. And then I wrote a book about steroids called The Wikipedia of Steroids, which is a factual book about what to take, how to take it, how you take it. And I don't advocate the use of it. I'm not saying take it. I'm suggesting maybe you don't. But if you do want to know what to do, this will tell you how to do it and keep you from getting any ill affection. Thanks for watching Rick's Tip of the Week, and I'll see you next time I have Rick's Corner.
It's rickdrasin.com. He is the equalizer, baby. See you next time.